am Ivy C. Hermosa. I am 18 years old from grade 12 Ladja. Our topic is all about effectivity of first aid for musculoskeletal injuries. What are the risk factors in dancing? Risk factors for dancing injury include previous history of injury, insufficient skills in coping with stress, low body, mass index, and fat levels, risky movements and technique, and overtraining. Chronic and acute injury. Acute injury is a sudden injury that is usually associated with a traumatic event such as clashing into another blade during sports or fall from a bike. Chronic injuries are health problems that can develop slowly and last a long time. If they're not treated promptly, they can cause a lifetime of pain, inflammation, and overall discomfort. What is the difference between an acute injury and a chronic injury? Acute injuries happen suddenly, such as sprained ankles, and the chronic injuries happen after played a sport or exercise over a long period of time. The example of chronic and acute injuries. What is the example of acute injuries? The example is sprained ankle, strained back, or fractured hand. When you have an acute injury, there are things you can do to minimize tissue damage, protect from further injury, and promote faster recovery. Chronic injuries. What are examples of chronic injuries? The example of chronic injuries is tennis elbow, swimmer's shoulder, runner's knee, and jumper's knee. Acute and chronic injury, it is important when sport injury occurs that the athlete is quickly assessed in order to determine. Let's warm up. Rehydrate by drinking enough water even when you are thirsty. End the session with a cool down exercise to allow the body back to its course. Acute and chronic injury, it is important when sport injury occurs that the athlete is quickly assessed in order to determine.